What are ADOS-2 cutoff scores? Have you ever wondered how professionals determine if someone has autism spectrum disorder? One important tool in this process is the Autism Diagnostic Observation Schedule, second edition, often called ADOS-2. A key part of this assessment involves understanding ADOS-2 cutoff scores. So, what exactly are these scores, and how do they work? The ADOS-2 cutoff scores are specific numbers that help clinicians decide if a person's behaviors align with the criteria for autism spectrum disorder. These scores come from total algorithm scores, which mainly focus on social communication behaviors. While the assessment also looks at repetitive or stereotyped behaviors, those do not factor into the total cutoff score. The ADOS-2 is designed with different modules that cater to various age groups and language abilities. This means that there are different cutoff scores for toddlers, children, adolescents, and adults. Each module has its own expectations for behavior based on developmental stages. For instance, a module for a nonverbal toddler will have different criteria than one for a fluent-speaking adult. When a clinician scores an individual using the ADOS-2, they categorize the results into 3 groups based on the total score. If the score is at or above a higher cutoff, it indicates behaviors consistent with autism. If the score falls between a lower cutoff and the autism cutoff, it suggests behaviors that align with the broader autism spectrum. Finally, if the score is below the lower cutoff, it indicates behaviors that do not strongly suggest autism. It's important to note that a score above the cutoff does not automatically confirm a diagnosis of autism. Similarly, a score below the cutoff does not rule it out completely. The cutoff scores are just guidelines that assist clinicians in their evaluations. The ADOS-2 is part of a larger assessment process for autism spectrum disorder. Clinicians also consider the individual's developmental history, medical background, and input from caregivers. The ADOS-2 provides a direct observation of social and communication behaviors, which is essential for understanding autism-related symptoms. Typically, the ADOS-2 assessment takes between 30 to 60 minutes. After the assessment, the clinician scores the behaviors according to the specific module's algorithm. They then compare the total score to the module's cutoff scores to classify the behaviors. This classification helps guide the clinician in making an informed diagnosis and developing appropriate support plans. Understanding ADOS-2 cutoff scores is important for grasping how behaviors are measured in a structured way. However, it is essential to remember that each person's experience with autism is unique. Cutoff scores are just one part of the larger picture that includes individual strengths and challenges.